Thank you. 'Tis the season for all kinds of ailments, everything from colds and COVID to flu and walking pneumonia.
And walking pneumonia described as a mild lung infection that can happen any time of the year, but it's most common in the fall and winter. 13 Action News reporter Lisa Guyton live with the story. New at 5:30 tonight. Lisa.
Well, like a lot of you, I know a few people who've been diagnosed with walking pneumonia in recent weeks. The pediatrician we spoke with says there's been a significant spike in the number of patients he's seen with the infection.
This year, we're seeing it sort of flood through the school-age community like we've never seen happen before.
Dr. John McBride is with Franklin Park Pediatrics. He says there's been a big jump in the number of walking pneumonia cases at the practice.
It's really contagious this year. I've seen 2 or 3 cases or maybe 5 cases in a month, and it's like 5 cases in a day.
According to the Cleveland Clinic, walking pneumonia is a mild lung infection. Its causes are things like bacteria, viruses, or mold. Symptoms can include a sore throat, sneezing, coughing, a headache, mild chills, and a low-grade fever.
It's a specific bacteria called Mycoplasma pneumoniae, and classically it hits sort of all throughout your lungs, so it's not in just one little spot, but it's not as bad anywhere.
Anyone can get walking pneumonia, but people who have conditions like a weakened immune system, COPD, asthma, or emphysema are among those more likely to get it. Dr. McBride says there are also certain age groups that are most susceptible.
The people who are most likely to get it, we felt were sort of age 5 to maybe age 20, but we are finding nowadays as our testing gets better, you can get it at younger than 5, you can get it as an adult. It does seem to hit sort of school age, high school, college kids the most.
Treatments include antibiotics and over-the-counter medicines, but Dr. McBride says some of the classic antibiotics are not working.
Zithromax or a Z-Pak as erythromycin, clarithromycin, and those were very good, but unfortunately overuse of antibiotics has caused Mycoplasma to become very resistant to those antibiotics.
Dr. McBride shares some simple reminders that are worth repeating because they could help keep you and those around you healthy.
Covering your cough, washing your hands, staying away from other people when you're sick, possibly using a mask. All of these classic things that work for every illness.
Experts say walking pneumonia is very contagious. When someone who has it coughs, sneezes, talks, sings, or breathes near you, tiny droplets containing the disease enter the air, and the illness spreads if you inhale those droplets. You're contagious for 2 to 4 weeks before the symptoms appear. Christian?